Hi, welcome. I'm Kate Grace, physical therapist, founder of Our Joint Effort. This is our third podcast, first live. So it's not being edited. We're not going to stop. We're going to keep going. So there might be a few boo-boos. So bear with us. Today, I want to talk about the most common orthopedic problem in the world, which is low back pain. If I asked you how many of you have low back pain, probably the number that don't have it would be less than the number that do. What's the prevalence? 700 million people in the world have low back pain, about 40% of people in the United States. So it's something that it's hard to get away from. And why is that? Well, we'll talk about that. So I want you to have a good understanding of what it is and what it is involved in the causes. So let's help you avoid low back pain. So I'm going to give you a 1 minute, maybe two, anatomy lesson, just a little bit. So this is your spine, and these are your vertebrae, the bones. In between the bones are discs, and they are the cushion or the bushing between the vertebrae, because bone on bone isn't very pleasant. Then you have the spinal cord, which runs through from your brain down through your whole spine. And then you have these nerves that come off the spinal cord, and they come through a hole that's called the foramen. And they go down and stimulate and innervate all the muscles in your lower body. And then you've got joints. So these are called facet joints, and there are these joints in between each vertebrae, and they're not unlike any other joints. I mean, they can get arthritic and change, and that is a big cause of low back pain. So you hear all the time about, oh, I have herniated disc, I have a slip disc, I have a whatever disc. So what is that? The disc is made up of 80 to 90% of water and an aqueous gel-like solution. What keeps it in there is called your annulus fibrosus, nucleus pulposus, annulus fibrosus, which is a fibrocartilage that goes around the whole circumference of the disc, and it holds it in there. So what does it mean when you herniate a disc? Well, here's the most common cause of back pain. You tear the annulus. You create a little bit of a tear in that cartilage. So what is your body's reaction to that? It's to tighten up the muscles around it really tight. Why? It doesn't want you to tear it anymore. So it's not unlike you sprain your ankle, and what happens? Your ankle gets all swollen and sore. Why? It doesn't want you to stretch that ligament out anymore. Very, very same thing. I have patients who come in and see me and go, well, I've got this, back muscle pain. No, you don't. It's really the cause of the annulus. Now, if you're good and you behave yourself and get good physical therapy, then that annulus can heal. It's got a blood supply. But if you're not good and you keep tearing it, it opens up, and that's when the disc material can come out. Only comes out posterior lateral. So unfortunately, what's there? Your nerve. So what happens is you get a little pinch on the nerve, and there's a nerve root right there. And if that material is pushing against the nerve, causes pain, inflammation, and it can give you symptoms down your leg of pain and numbness and tingling. So our goal in physical therapy is to make sure that your spine is in alignment with the rest of your spine and the rest of your body. And that foramen is big. So when the nerve comes out, it's not being impinged. So your spine you have vertebrae all the way from your neck. So your neck should go concave a little bit, or lordotic. Your mid back should be convex, and then your low back goes concave again. These have to be in alignment to make sure that there's no abnormal forces on your spine or your musculoskeletal system. I had a guy come in to see me one time, and he walked in and his posture was like this, and he had neck pain. And I'm like, oh shit, Sherlock, you can't get rid of neck pain without getting his big old bowling ball head back on his neck. So his whole neck lost the curve and it was forward. And this happens with sitting forward, poor posture over time, and repetitive sports. So as a physical therapist, we look at you from head to toe, and we make sure that all those spinal curves are in alignment. And we have to determine if the cause of your pain is from these joints or the nerve or nerve root or something else or a collapsed disc. That's what we figure out. And if you don't determine the actual cause, diagnose the cause of the problem, the cure is elusive. So it takes a really great exam to figure that out. So what do we do in physical therapy? Here's what, if you don't get this in physical therapy, you've not gotten physical therapy. There's a science and an art to physical therapy. And the art is taking a good history. So these are the 5 things that happen when you walk in the door to see me. And this is just like, if you're seeing me now, it would be the same thing. Take a really good history, do a really good exam, diagnose the pain source of the problem, explain it to the patient. How about that for concept? I want you to understand, what it is that you have so you can help in the process, and treat you manually, because you can't change the musculoskeletal system without getting your hands on the patient. I love AI. It's great. And it's very informative. It will never look you in the eye and say, how are you today? And get their hands on you and help you heal. It just is never going to happen. So, and then the last bit, the 5th thing is that then I give you a few exercises to do at home to maintain all the gains that we got so you come in even better than you were before. That if you go to physical therapy and they spend 5 minutes with you and then they shove you off to an aide or somebody else and they say, go do these exercises, you have not gotten physical therapy. I can't tell you how many times our patients have said, oh, I had PT, it didn't work. Well, where'd you go and what'd they do? Well, that's what happened. So you did not get this. So I think it's important for you to also understand the disc pressure in different positions. So a long time ago, I still can't believe this, is Nachemson, this orthopedic surgeon, Swedish. He talked volunteers into letting him put a probe, they're awake, they're not anesthetized, a probe into the disc and then say, do this, sit down, bend forward, lift this up. And he measured disc pressure. So it's really great for us because we now have a great understanding of the pressures and also the ergonomics and how to fix that. So let's just say standing is 100%. That's the baseline. Sitting increases the disc pressure by 140%. Even sitting, bending forward, increases it by 185. Standing, bending forward, increases it by 200%. And standing, bending forward with a load, increases it by 250%. So if you have back pain, don't sit down. So what you want to do is you want to get in the one position I tell my patients to get into is 90-90. So lay down, like look around your house now, like where you are. Where can you lay down, get your hips at 90 and your knees at 90? So imagine you're laying on the floor and you've got your legs up on the back of a chair or an ottoman, something like that. That takes the weight-bearing forces off your back. So because of this study, we know lying down takes the pressure off your disc and your back, sitting, standing, bending forward, twisting, carrying a load, which is every athletic activity, increases the pressure exponentially. So our spines, and I'm a golfer and I hate to say this, are not meant to go through all those revolutions that we do in golf. I mean, it is a bushing, it does absorb pressure, but it doesn't like shear forces, which is what rotation is. So we have to make sure that we take care of our disc as much as possible. Also, sadly, because it's a lot of water, it decreases over time, and that's why you get shorter. So we lose the disc height. And then the other responsibility for us as physical therapists is to each subsequent appointment, you should progress. I walked in this clinic one day and I said, oh, why are you doing that over there? He said, oh, we do that on Tuesday. I'm like, what? That makes no sense. So each subsequent appointment, you should get reevaluated, and then your problem, your PT and your exercises at home should progress, and what we do with you manually. So every time you go to PT, it should be different, and you should feel like you're progressing. And here's was our rule at Evolve. Every time a patient leaves our office, they're better. Their pain's better, their range of motion's better. They know how to get in and out of their car. They know how to get in and out of bed. Here's another thing. If your job requires you to sit at a desk, get a stand-up desk, get an adjustable desk so you can stand up, you can sit down, you can stand up, you can sit down. And then the other thing we make sure we look for those red flags. So if you're having loss of bowel and bladder function, pain that doesn't change when you move or change position, like if you lay down, it should get better. And then night pain. So those three things are red flags. We want to make sure that we address those and maybe get you in to see someone sooner than later. And by the way, I've always said, I think every patient should be treated like a professional athlete. Our goal at our clinic in San Diego was when you call, you get in within 48 hours because there's no reason to wait. Like if you have back pain and you go, well, I'm going to give it a few days or I'm going to give it a week or so, that's fine. But 3 months, 6 months, I've taken so many histories where someone said, well, I got this pain about 4 months ago. And I'm like, well, what are you doing about it? And when people come in right away, they were usually done in our office within 1 to 2 weeks. So imagine getting rid of your pain in that time frame and not have to not play your sport or not go to work or not play with your grandkids or your kids. It's ridiculous. It doesn't make any sense. So the things that the other things that people have asked as, well, maybe I should just have surgery for this. Well, there are lots of surgeries. There's laminectomies and discectomies. There's fusions. There's artificial disc replacement. But a lot of back surgery fails. And so I always tell people, it doesn't matter what kind of surgery we're talking about. I always tell people to make sure that you exhaust all optimal treatments. Optimal, not the go in the corner and do these exercises, but optimal. If you have, and our guest next week is our regenerative medicine specialist, will tell you that that's got to happen before you consider surgery. And I'll tell you more about that at the end. But I want to make sure you consider surgery as a last effort. The other thing is that this is a multifactorial problem. We make sure we look at you from head to toe. So like if you came in, let's say you're watching and you have shoulder pain, I would never just look at your shoulder. I would look at your whole posture, head to toe. And when you eliminate those posture faults, and they're called predisposing factors, you eliminate the pain for good. Because if I didn't get his head back like this, I may work on his neck and he may feel better, but it's never going to last. So you have to make sure that you restore all those curves and you make sure that you identify all the factors. Maybe you're weak, maybe a weak trunk, maybe you're inflexible, maybe you have a shoulder obliquity pushing down on that side of your back. All these things affect your back. And one last thing I want to say about early treatment. I started at Sharp Hospital, and I was maybe barely out of residency, and I would take this history and would say, well, I got back pain 4 months ago, and I went to my primary care doctor, and she gave me this muscle relaxant, and so I took that, and it didn't work. And then she sent me to specialist. She said, oh no, that's not the right thing. Next month, take this anti-inflammatory. So I did that, and that didn't work. And then finally said, well, maybe I better send you to somebody who can help you. And I'm taking this and I go, this is ridiculous that you've had this pain all this time. Besides, they're at home, not working, sitting on the couch, eating Cheetos, watching TV, and thinking, this is a pretty good gig. So I went down to the ER doctors at the hospital and I said, you don't want to see this low back pain. It's annoying to you. You want to see the trauma, the open compound fractures. You want to see that kind of stuff. So for 3 months, let me do this. Every back pain patient, acute back pain patient that just hurt their back, came into the ER, I will see them 24/7. Doesn't matter if it's 2 a.m. or 2 p.m. I will see them. So they clear them. They took them. They sent them to X-ray, cleared them. Of course, they didn't fracture anything. And then they called and they paged me, pager. And so I went down. I examined them. And the good thing about working in the hospital is that we were open 7 days a week. And so I would take them right down to therapy. So they just hurt themselves, just got to the hospital, and now they're going to start physical therapy. And so that's how people should be treated. So after a year, I looked at all the numbers, in particular this company that built these great big, things, helicopters and planes and things, and they had an enormous amount of problems with their back pain. And so I looked at their numbers. prior to our study, their average cost for identified with low back pain for the time that the person was off was $60,000. Now, this was a long time ago. It's probably $100,000 today. $60,000, and the average time off work was 4 months. Some was a little less, some was 6 months. So they had to pay the person. They had to get somebody in to do their job. They had to pay the medical costs. At the end of the year, after our treatment, getting people in right away and doing the right thing, doing the manual therapy, looking at people head to toe, the average cost was $1,500, and the average time off was 3 days. So a little bit different. And that's why if you hurt, okay, a few days, but don't wait months and months and months. And also, if you have to make sure that you're seeking out the best care, and you want to make sure that you want to get back to whatever activity you want to do. So make sure that somebody there knows how to do that for you. So I want to show you, we've been sitting for a few minutes now. I want to show you a couple things that you can do yourself. And I want to go through, I talked about the curves. I want to go through the 8 movements of the spine that you can get up right now and test yourself and make sure that you're symmetrical and you've got a lot of flexibility. So let's go through those 8 movements, and then I'm going to show you 3 exercises that you should do to undo that sitting posture that puts all that pressure on your back. And all the activities we do is for, you talk to someone, you're forward, you work on your computer. You can't work on your computer laying back. And so I'm going to show you those movements right now. So your back should, here's one of them, flex. So you bend over and your body rounds and it flexes. You put your hands, this is the most important one, back here in your pelvis and bend backwards, all the way back. That's extension. Side bending. Go to one side. How does that feel? Does that hurt? And go to the other side. And maybe I'm a little less flexible than that. Next is rotation. Your body rotates. Am I equal? Side to side. And here's one no one knows about and everybody forgets. It's called side glide. And your body does side glide. So you want to move from your waist down. So you're going to shift your hips one way. And then you're going to shift your hips the other way. So you're going to go here and here without moving your upper body. So test those on yourselves. So one of the most important things you can do, get it up from your desk 30, 60 seconds, after 30 or 60 minutes, and do this. Put your hands in your pelvis and push it forward and lay back and come on up and do that several times. The other thing you want to do is find a corner in your house. So I'm going to use a corner on this bookcase. Line yourself up with the corner and squeeze your shoulder blades back against the corner. Just hold them maybe 5 seconds and then relax and then squeeze them again and do that. And then the last one, I love this one. So I'm going to describe it. You can watch this later, but if you want to do it with me now, we're going to stand with our right side against the wall. I know you can't see my legs, but I'll talk you through it. Right hand goes up on the wall. Right leg goes outside your left. Left hand comes up and you grab the wall and you rotate to your right. So everything's right. Right hand up here. Left hand goes up here. Rotate to the right and then do the other side. So if you can get some extension and some rotation, that will loosen up your back tremendously. Now, there's a lot of other factors go into this low back pain challenge. We already talked about this. So vertebral immobility, flexibility, strength, weight. Look how little this thing is. Doesn't like a lot of weight on it. So I'm going to suggest that you look at your nutrition and you maybe make some choices. So here's maybe let's pick one thing. Let's not pick a bunch of things. Let's pick one thing. Let's say you're weak and you need to get stronger. All right, How are you going to do that? Well, maybe you like going to the gym and you just haven't. You make a commitment. I remember when I worked at our office, I would, in the middle of the day, I would block out my schedule, run across the street to the gym and come back. Sometimes I work out in the morning before work, but my team would say, Kate, can you see this person here at 12 o'clock? And I'm saying, no, I got an appointment. That's blocked out. If you can't block out a couple hours a week for yourself, something's the matter. Or maybe you like to take a class, or maybe you want to come take our class, our 50 Shades of Grace class. Find one thing that you can do right away to decrease your pain and to start on your healing course. So do you guys remember the Lakers long time ago, Pat Riley? He was a coach and they had a horrible playoff season. And so he said, okay, how am I going to help my team? So he created this, what was it called? Career Best Effort, CBE. And he went to his team and he said, and all the stats we keep in basketball, I want you to improve your stat by 1%, just one. Like free throws, if you're 57, be 58, 3-pointers, rebounds, whatever. Can you improve your stats, each of you, by 1%? And they're like, shit, I can do that. I mean, that's what's so hard about going from 57 to 58%. He said, okay, well, we're going to keep your stats every game, every practice, and we're going to see if you do that. Every person improved their stats by 1%. What it equated to was an overall huge improvement in the stats of the team. They won the national championship that year, and they did something that has not happened in 2 decades. They repeated and won the championship the following year. So that's just picking one thing, one little thing. That's all you have to do. And if you want my help and my suggestion for it, great. You know, that's what I'm here for. So that's very quick. I'm going to do a long series on low back pain, like our total knee series and our foam roller series on our website. But this is just the kind of down and dirty of having a good understanding of what it is. We're going to move into a segment that I think is a fun segment and good for you, called AKA Ask Kate Anything. And I know there's been some questions. I'm hoping that someone will come in here and give me one of the questions that was asked. But I'll tell you that a question I just got asked this week. And I love to hear this too. This twice. This person goes, well, I hurt my shoulder and I'm going to go get an MRI. I go, well, how about like getting a good exam or seeing somebody first? So people ask me, do I need an X-ray and do I need an MRI for this? What you really need first is a good exam. And then what we do with MRIs and X-rays is confirm or deny. Like, does this make sense that this is what's happening, or does it not make sense? And we're planning a surgical course. So you don't really need one, and I wouldn't rush to get one. I would rush to a really good doctor and a really good physical therapist to do a great exam. So do we have a question?
We do have a question. We hear so much about the importance of keeping the spine flexible, but what is more important, flexibility or strength?
I don't know if you heard that, but what's more important, flexibility or strength? Well, in your spine, both. We can take, so every vertebrae, and you can even see this in this anatomical model, every vertebrae has a certain amount of movement, right? It moves different directions and it should have a certain amount of movement. Just like you should have a certain amount of movement in your neck. You should have a certain amount of movement in your shoulder or your knee or your hip. So we can mobilize each one of these joints. We can push on each one of these joints to mobilize your spine and to return flexibility. So let's say out of the 5 vertebrae, 1 through 5, let's say L4-5 isn't moving very well. We can mobilize that specific joint and get it to move. Then when we retest you and see that your movement is better, then we will strengthen you within that better movement. So we don't want to strengthen you in the tight movement. We want to strengthen you in the more flexible. And also, by the way, this posture malalignments, I correct people's posture, then I strengthen them in that good posture, because I don't want to strengthen you, like this. So we want to make sure that we're in good alignment before we do that. So I don't know if there's any other questions. I'm trying to keep this to 30 minutes. I know that's probably longer than a lot of people's attention span, but I just want to let you know a couple things that next, I'm going to do this live segment every other week. And so you'll get an opportunity to ask your questions. If you're watching this later, then put in the comment your question and I will reply to everyone. Do we have another question?
Well, and going back to the spine.
Part 2?
Yes, heat or ice?
Oh, that's a good one. Heat or ice. Is that coach there?
Yeah.
So that's a really good question. For acute injuries where there's swelling, you always want to ice, because heat will increase your inflammation. If it's a chronic problem and you've had it for a long time, then you want to use heat because it'll help loosen things up. But great question. People ask me, how long do I ice or how long do I heat? So they give you these instructions after surgery. Ice for 20 minutes, then take it off. Ice for BS. Put it on all the time. Keep it on all the time until your swelling is gone, because A, it'll help get swelling up, but B, it'll make you feel a lot better. So after all my 10 knee surgeries, I kept that Polar Care on 24/7. You can ask someone because they heard it all the time. And then heat is really good for chronic problems. One more?
We also need to know why the foam roller needs to be so long. You mentioned 3 feet
Oh,
long.
I happen to have my foam roller right here. So I'm glad you asked that. Here is the length of the foam roller right here. It has to be this long because when you do exercises, you need to be able to lay on this head to tail. And so if you have that little short one, you're going to get part of your spine. And I love our foam roller program. You can look on our website for it. You lay on it and your body just naturally extends over it. This is the only way I have found, and we'll do a live segment on the foam roller. I'll show you some things. I have found to get people in extension, out of flexion. In my whole career, I've not found anything that works this well. And so while you're laying on it head to tail, we do specific exercises on it. And so you're going to feel, when you get off of this, you're going to feel like you are perfectly aligned and your body you have no tension anywhere, and you're laying on the floor and you're connected to the floor. So I want to tell you, you can go to our website and find out all of our great things there, our class membership, our total knee. I created 25 videos on a total joint replacement because it starts with, how do you know you need one, all the way through to the end, to sports specific training. And this older, well, let me just say, well, she was maybe 80, maybe in her late 70s. She went to the doctor and he said, she had knee pain, and he said, oh, you need a total knee replacement. And so her son said, well, can you look at her and see? So she came in to see me as a patient, and I had to bring her x-rays and MRIs. Now, you probably know, why do we do total knee replacements? Because you've worn all your cartilage down. You've got bone on bone, right? So I examined her, and when you do a knee exam, and we'll do this on the segment, you can tell if the cartilage is worn away because the knee kind of ratchets. It kind of goes, not a good thing. So there's no smooth cartilage in there. And so I did that on her, no ratcheting. I looked at her x-rays and her MRI. She had perfect cartilage in her joint space. And I said, you have a problem with your plica or your synovium. I said, we can fix this. She was out of therapy, done, full recovery, no pain in 2 weeks. So this poor woman would have had a total knee replacement if she wouldn't have asked us. And she walks her 80-pound dog, she kayaks, and she bikes, pain-free. So just be aware of it. That's the whole point of our joint effort, is give people really great orthopedic medical advice. So if you have a question, put it in the comments, jump on YouTube, jump on Instagram, jump on Facebook, ask us a question, and let us help you. So I'm very excited about next week. I am fortunate enough to know one of the leaders in the world in regenerative medicine. And this is a field that is phenomenal. It's changing the way orthopedics, a lot of the things that we used to operate on, we don't have to now. Very low risk, high reward success rate, and he's one of the best in the world. So you're going to hear him next week, same time, Thursdays, 3:00. And if any of you are in the medical field or physical therapists or PAs or trainers who are watching, this is something you need to know about, because you are going to need to talk to your patients about it. I never went one day in my office without talking about regenerative medicine. So I'm really excited that I know him and you're going to get to hear him. So thank you so much for tuning in. It's been fun. Our first live. I don't know if there have been too many hiccups, but I appreciate all the support from everybody, and we'll see you next week.